The sweet potato or sweet potato is a dicotyledonous plant that belongs to the bindweed or morning glory family, Convolvulaceae. Its large, starchy, sweet-tasting, tuberous roots are used as a root vegetable. The young shoots and leaves are sometimes eaten as greens. Benefits: sweet potatoes are effective in preventing vitamin A deficiency. They contain high levels of beta-carotene, which is transformed into vitamin A in the liver. Vitamin A helps in fighting infections in the body. Sweet potatoes help in managing diabetes. They are considered to be low glycemic food, which means they release sugar into the bloodstream slowly, which aids in controlling the blood sugar levels in the body. Sweet potatoes help in stress management. They contain significant amounts of magnesium, which assists in reducing stress and anxiety. Sweet potatoes contain a vast amount of vitamins which have powerful anti-inflammatory properties. They contain choline, which helps in reducing inflammatory responses in the body. Sweet potatoes, especially orange ones, have excellent amounts of beta-carotenes, which are converted in the body into vitamin A. As they are also a plant rich in vitamin C, a potent antioxidant that protects the body's cells against inflammation and free radicals, sweet potatoes promote firmer and wrinkle-free skin. Sweet potatoes are rich in both soluble and insoluble fiber, especially when consumed cooked and with the skin, so they help to form fecal clumps and stimulate bowel movements, combating constipation. In addition to working as a natural prebiotic, it is a source of food for the beneficial bacteria in the intestine, helping to balance the intestinal flora, treating and preventing constipation. Despite having good amounts of carbohydrates, sweet potatoes are also high in fiber, which causes them to end up having a low glycemic index. This means that it helps to slow down the absorption of sugar after meals, preventing blood glucose spikes. This property of sweet potato is essential to prevent diabetes, but it can also be recommended, in small amounts, for those who already have the disease. Sweet potatoes are a good source of beta-carotene, the antioxidant that helps promote eye health. Sweet potatoes are a good source of fiber, which is beneficial for the digestive system and may help lower cholesterol levels. Sweet potatoes can be a part of most diets, including carnivorous, paleo, vegetarian, and plant-based. Possible side effects: sweet potatoes can be higher in carbohydrates, so if you are counting your carbs, be sure to check your serving size. The symptoms of a sweet potato allergy range from mild to serious. They can affect the skin, respiratory system, and digestive tract. It can also trigger a fatal reaction called anaphylaxis. It is important to pay attention to how you feel after consuming foods other than those you are used to and, if necessary, seek medical attention. There are no severe health problems that are associated with consuming sweet potatoes. However, since they are rich in vitamin A, excessive uptake of sweet potatoes may lead to a little discoloration of the skin and nails to a little orange. Quantity recommendations: including a variety of sweet potatoes in the diet every week may be very beneficial in one's health. They will help in meeting the recommended daily intake of a vast number of nutrients. My recommendation is to eat at most one small unit per day, around 50 g or 0.11 pounds. You can consume it in a single meal or split it in two, it depends on your glycemic index. If you are diabetic or pre-diabetic, it may be better to avoid frequent consumption. Sweet potatoes are a great addition to most lifestyles and can be included throughout the week. They are a great source of antioxidants, fiber, vitamin C, and beta-carotene.